Have you ever wondered what subtle signs your body might be giving you before a major health event like a stroke? How can we recognize these signals early enough to take action and potentially save lives? In today's video, we'll explore the crucial early warning signs that could indicate a stroke is on the horizon. Strokes can strike suddenly, but there are often subtle symptoms that appear weeks before the actual event. Being aware of these signs can make a huge difference in getting timely medical help. So, stay tuned as we uncover these vital warning signs. We'll also discuss lifestyle changes and preventive measures that can lower your risk of stroke. This knowledge is empowering and could be life-saving. Don't forget to like, comment, and subscribe for more health tips and advice. Let's get started on this important journey to better health and stroke prevention. 1. Sudden weakness in limbs. Experiencing sudden weakness or numbness in the arms or legs, especially on one side of the body, is a critical warning sign of an impending stroke. This weakness is often due to a reduction in blood flow to the brain, which can affect the motor areas controlling these limbs. The sensation may feel like a heavy, limp feeling, making it difficult to perform everyday tasks. If you notice that simple actions like holding a cup or walking become challenging, it's essential to seek medical advice. This symptom may appear intermittently, becoming more frequent as the potential stroke nears. This occurs because a stroke impairs the brain's ability to control muscles. The sudden onset of limb weakness can be transient, sometimes lasting only a few minutes or hours before seemingly resolving. This phenomenon is often referred to as a transient ischemic attack, TIA, which serves as a critical warning sign of a potential stroke. Ignoring these episodes can be dangerous, as they indicate that part of the brain isn't receiving enough blood flow, potentially due to a clot or narrowing of the arteries. Recognizing and addressing this symptom promptly with medical attention can significantly reduce the risk of a full-blown stroke. 2. Speech difficulties. Speech difficulties, such as slurred speech, difficulty finding words, or complete inability to speak, can also signal an impending stroke. These issues occur because a stroke can affect the brain regions responsible for language production and comprehension. People may notice that their speech suddenly becomes garbled or that they can't articulate words properly, even though they know what they want to say. This can be frustrating and frightening for the individual and alarming for those around them. Sometimes, these speech difficulties are accompanied by confusion or trouble understanding others. Like sudden limb weakness, these symptoms can be transient, known as TIAs, and should never be ignored. They indicate that the brain is experiencing temporary disruptions in blood flow. Seeking immediate medical attention when these symptoms arise is crucial, as early intervention can prevent a more serious stroke from occurring and potentially save lives. 3. Vision problems. Vision problems, such as sudden blurred vision, double vision, or even temporary blindness in one eye, are another potential warning sign of a stroke. These visual disturbances occur because a stroke can affect the parts of the brain responsible for processing visual information. Individuals might experience difficulty focusing, a sudden loss of peripheral vision, or visual field cuts where portions of the visual field are missing. These symptoms can be particularly disorienting and may occur suddenly, often resolving within minutes or hours. However, even if vision returns to normal, these episodes should not be dismissed. They may indicate that the brain's blood supply is compromised, increasing the risk of a full stroke. It's crucial to report any sudden and unexplained changes in vision to a healthcare provider immediately. 4. Severe headaches. Severe headaches, often described as the worst headache of one's life, can be a precursor to a stroke. These headaches come on suddenly and are typically more intense than any previous headaches experienced. This type of headache may signal an impending hemorrhagic stroke, where a blood vessel bursts in the brain. The pain can be debilitating and may not respond to over-the-counter pain relievers. The pain may be accompanied by other symptoms such as nausea, vomiting, neck stiffness, and sensitivity to light. While not all severe headaches are strokes, the sudden onset and intensity of the pain should raise concerns, especially if it is unlike any previous headaches. If you experience a headache that feels different from your usual ones, especially if it's sudden and severe, it's crucial to seek medical attention immediately. 5. Sudden dizziness or loss of balance. Sudden dizziness or loss of balance can be an early warning sign of an impending stroke. This symptom may occur sporadically and can be quite disorienting. The dizziness might feel like the room is spinning or as if one is about to faint. The loss of balance may lead to frequent falls or an inability to coordinate movements properly. People experiencing this symptom might find it challenging to perform daily activities such as walking, driving, or even sitting up straight. The dizziness can be more pronounced when changing positions, such as standing up quickly. It's crucial to note that this dizziness is not the same as the lightheadedness caused by dehydration or low blood sugar. It is often more severe and persistent. In some cases, this symptom can be mistaken for vertigo, but it is essential to seek medical attention to rule out the possibility of a stroke. 6. Persistent elevated blood pressure. Persistent high blood pressure, or hypertension, is a significant risk factor for stroke, primarily through its damaging effects on the cardiovascular system. Over time, hypertension exerts excessive force on the walls of arteries, causing them to become thicker, narrower, and less flexible. This chronic stress can lead to atherosclerosis, a condition characterized by the buildup of fatty deposits and plaques inside the arteries. These plaques can restrict blood flow or rupture, leading to the formation of blood clots. In the brain, restricted blood flow can result in ischemic strokes, where brain cells are deprived of oxygen and nutrients. Additionally, hypertension can weaken blood vessel walls, increasing the likelihood of an aneurysm, a bulging, weakened area in the vessel, that can burst and cause a hemorrhagic stroke. Both types of strokes can result in severe brain damage, impairing functions controlled by the affected brain region, such as speech, movement, and memory. Effective management of blood pressure through lifestyle changes and medication is crucial in reducing the risk of stroke and maintaining overall cardiovascular health. 7. Fatigue and exhaustion. Fatigue and exhaustion, especially when they occur suddenly and without a clear cause, can be early indicators of a stroke. This type of fatigue is often overwhelming and does not improve with rest or sleep. It can affect one's ability to perform routine tasks and reduce overall productivity. The exhaustion may be accompanied by a sense of heaviness in the limbs or a feeling of being physically and mentally drained. This symptom might lead individuals to become more sedentary, which can further exacerbate health issues. The fatigue can also impact mood, leading to irritability, depression, or anxiety. The underlying cause of this fatigue could be related to reduced blood flow to the brain, which affects the brain's ability to function properly. It is often mistaken for general tiredness or stress, but when it is severe and persistent, it warrants medical evaluation. 8. Numbness or tingling. Numbness and tingling, particularly in the arms, legs, or face, can be a precursor to a stroke. This sensation often occurs on one side of the body and can come on suddenly. The numbness may feel like a loss of sensation or a pins and needles sensation that does not go away. It can affect fine motor skills, making it difficult to hold objects, write, or button clothes. The tingling might spread and become more pronounced over time, indicating a progressive issue. This symptom is caused by a lack of proper blood flow to certain areas of the brain, leading to nerve dysfunction. It is crucial to pay attention to the specific areas affected and the duration of the symptom. Ignoring these signs can lead to more severe neurological damage. Seeking prompt medical attention when experiencing numbness and tingling can help in diagnosing the underlying issue and preventing a stroke. 9. Difficulty swallowing. Difficulty swallowing, or dysphagia, can be an early symptom of a stroke. This issue can manifest as a sensation of food getting stuck in the throat or an inability to swallow liquids without choking. It can lead to malnutrition or dehydration if left unaddressed. The difficulty swallowing might also be accompanied by coughing or a feeling of tightness in the throat. This symptom occurs due to disruptions in the brain areas responsible for coordinating the muscles involved in swallowing. It can significantly impact one's quality of life, making eating and drinking a challenging task. In some cases, individuals might avoid eating due to fear of choking, which can further deteriorate their health. Recognizing this symptom early and consulting a healthcare provider can help in identifying potential risks and taking appropriate measures to prevent a stroke. Treatment may involve speech therapy or dietary modifications to ensure proper nutrition and hydration. 10. Cognitive changes. Cognitive changes, such as difficulty concentrating, memory loss, or confusion, can be subtle indicators of an impending stroke. These changes may occur gradually and can be easily overlooked or attributed to aging or stress. Individuals might find it challenging to remember recent events, follow conversations, or complete tasks that require attention. The cognitive decline can affect decision-making abilities and lead to poor judgment. This symptom is a result of impaired blood flow to the brain, affecting its ability to function optimally. Seeking medical advice when noticing these symptoms can lead to timely diagnosis and treatment, reducing the risk of a stroke. Lifestyle changes and preventive measures to lower your risk of stroke. Preventing a stroke involves adopting a series of healthy lifestyle changes and implementing effective preventive measures. Here are some key steps you can take. 1. Maintain a healthy diet. Eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help manage your weight, cholesterol levels, and blood pressure. Reduce your intake of salt, saturated fats, and processed foods. 2. Exercise regularly. Engaging in regular physical activity, such as walking, jogging, swimming, or cycling, can improve cardiovascular health, lower blood pressure, and maintain a healthy weight. Aim for at least 150 minutes of moderate exercise per week. 3. Manage blood pressure. Hypertension is a major risk factor for stroke. Monitor your blood pressure regularly and follow your doctor's recommendations for managing it through lifestyle changes and medications if necessary. 4. Control blood sugar levels. If you have diabetes, keeping your blood sugar levels within the target range can help prevent complications, including stroke. Regular monitoring, a healthy diet, and medications can aid in managing diabetes. 5. Quit smoking. Smoking significantly increases the risk of stroke. Quitting smoking can improve your overall health and reduce your stroke risk. 6. Limit alcohol consumption. Excessive alcohol intake can raise blood pressure and contribute to stroke risk. Limit alcohol consumption to moderate levels, up to 1 drink per day for women and up to 2 drinks per day for men. 7. Manage stress. Chronic stress can contribute to high blood pressure and other risk factors for stroke. Practice stress-reducing techniques such as meditation, deep breathing exercises, yoga, or spending time in nature. 8. Maintain a healthy weight. Being overweight or obese can increase your risk of stroke. Achieve and maintain a healthy weight through a combination of a balanced diet and regular physical activity. 9. Get regular checkups. Regular medical checkups can help detect and manage risk factors for stroke, such as high blood pressure, high cholesterol, and diabetes. Follow your healthcare provider's recommendations for screenings and treatments. 10. Take medications as prescribed. If you have conditions like hypertension, diabetes, or high cholesterol, take medications as prescribed by your doctor to keep these conditions under control. Thank you for tuning in. Understanding the early warning signs of a stroke is crucial for timely intervention and prevention. By recognizing these subtle symptoms, you can take action to seek medical help before it's too late. Remember, strokes can have devastating effects, but early detection and lifestyle changes can significantly reduce your risk. Stay informed and proactive about your health, and don't hesitate to consult with healthcare professionals if you notice any concerning signs. Share this information with family and friends, as it can help save lives. Thank you for watching, and make sure to like, comment, and subscribe for more valuable health tips. Stay healthy and vigilant, and we'll see you in the next video.